Have you heard about placenta previa? Well, in this video, you will be able to know what is placenta previa, types and treatments of placenta previa, as well as the cause and effect, the prevention, and the nursing intervention. So keep watching!
Placenta previa is a problem of pregnancy in which the placenta grows in the lowest part of the womb and covers all the part of the cervix opening. Then the placenta previa grows during pregnancy and feeds the baby or the developing baby. And placenta previa is the abnormal attachment of placenta in the uterus near or over the cervix opening, as well as what I have said a while ago.
For the cause and effect of placenta previa. So the cause of placenta previa, according to the researchers, is still unknown. But there are risk factors among women who are having a baby boy, had scars on the uterus from the past deliveries, including cesarean deliveries, uterine fibroid removal, dilation, and curettage. And also among women who are having more than one fetus, and also a women who are 35 years old older, and also on the women's who are smoking and using of cocaine. And for the effect or complications of the placenta previa, it is too much bleeding or hemorrhage, including the placenta previa doesn't attach to the uterus as it should, slowed growth of the baby on the uterus, preterm birth before 37th week of pregnancy, and birth defect.
Placenta previa usually cannot be prevented. In some cases, risk factors can be eliminated, such as smoking cessation. Bleeding from placenta previa can be reduced in many cases by bed rest, elimination of activities, and or avoiding sexual intercourses.
So here are the nursing intervention for placenta previa. First was pelvic rest. It includes no sexual intercourse, no vaginal exam, no abdominal manipulation, because we don't want to cause more damage to the placenta because it can lead to hemorrhage. Take note that treatment varies depending on what type of placenta the mother had. So if there is no bleeding or the placenta is low in the cervix, or it is just light bleeding, she would undergo bed rest with no strenuous activities until the baby is ready to deliver and continue monitoring. So, if there is bleeding, the pregnant woman should be hospitalized because there is a greater risk of hemorrhage. So, the mother may need blood transfusion or she needs IV access and see what type she has. If she is Rh negative, she needs retrogram. So, the baby needs to be monitored also, making sure the baby is doing good and not distressed. Monitor how much bleeding the mother has by calculating the pad she used. Also, it is important to monitor her vital signs every 15 minutes. Position the mother on her left side to promote placental perfusion. Monitor uterine contractions and fetal heart rate by external monitoring. This can assess whether the labor is present and fetal status and external systems. Avoid cervical trauma.
There is no medical or surgical treatment that cures placenta previa, but there are some management that ease the symptoms and prolong the pregnancy. It includes bed rest or hospitalization, close monitoring such as using a fetal monitor and regularly checking the mother's vital signs, blood transfusion for the mother, avoiding any activity that triggers uterine contractions or irritates the cervix such as sexual intercourse or orgasm, and a cesarean delivery is required for complete placenta previa. There are three types of placenta previa. First is the complete placenta previa that occurs when the placenta completely covers the opening from the womb to the cervix. Next is the partial placenta previa that occurs when the placenta partially covers the cervical opening. Lastly is the marginal placenta previa that occurs when the placenta is near the edge of the cervix.
For conclusion, placenta previa describes the placenta in the lower uterus instead of the upper uterus. The internal cervical os might be covered completely, partially, or marginally. That can cause bleeding that is painless, bright red, increased chances of pattern birth, and fatal hypoxia.